A third of the people I represent, and I represent the urban core of Las Vegas, have no health insurance. So it's imperative for the people that I represent that they have some access to health care through insurance. It's not as if people that don't have health insurance don't get sick. They get sick, and the additional cost is borne by the rest of us. I would say, statistically speaking, $1,000 for each of us that's insured. There's an extra $1,000 attached to the cost of our health insurance in order to subsidize others. In an effort to give full disclosure, my husband is a nephrologist. My stepdaughter is a primary care physician. We need more doctors. And we need to incentivize the opportunity for people to go to medical school, which is not only multiple years of their lives, but also a great deal of expense. When my stepdaughter graduated not graduated, but when she graduated, she had a $190,000 debt. I am a tremendous advocate of loan forgiveness, and also an advocate of increased GMEs. I think that's very important, and they need to be spread out around the country a little bit more proportionately than they are now. I don't think, look, this is a work in progress. I'm not willing to sign off on the legislation. A draft proposal that was dropped on Friday is the beginning of an important and comprehensive discussion among all the stakeholders and those of us that are going to be voting for it. That's why your being here is so important today. Hopefully this will be the first of many hearings in order to improve our expertise and knowledge so we could do the right thing and fine-tune this. Cost is definitely a factor. There's no doubt about it. But right now, we have the most costly healthcare system on the planet. We're not getting a bang for our buck. The doctors don't like the system. The hospitals don't. The patients don't. And we need to change the paradigm so that we're investing our money wisely and having a far better outcome than we have now. One of the things I'm a great advocate of is preventative medicine, and I'm the original sponsor of the DEXA bill. Medicare cut payments to people that need bone density tests by 60%, which means that the doctors aren't administering them anymore. The $19 billion it costs this country in order to pay for bone-related osteoporosis fractures every year. Let us take that money and put it in the front end. It's going to cost us less. We're going to have a whole lot less bone fractures. And statistically speaking, if you're over 70 and you break your hip, you're going to be dead within 10 months. It seems that we'll improve the quality of life, we'll enhance life, and we're going to save billions of taxpayers' dollars by using our dollars wisely in the front end of the process rather than in end-of-life care. And if any of you care to discuss any of those, I would love to hear your point of view. Ms. Pollitz?
Well, that was a lot and all excellent. I think just on the prevention, an important feature in the required essential health benefits package is that preventive services would be covered without any cost sharing so that people can have access to those services and not face those barriers. And that's an important component.
And may I say one thing, and it just gets my goat. I'm not the defender of every doctor on the planet, and I know we have a lot of real stinkers, but I'll tell you something, the doctors I know work like dogs, and this fraud and abuse thing is if every doctor is out to scam the system is highly offensive to me as a spouse. Just want to get that on the record.
I just add, it's not just about prevention, though. I fully agree with your comments on this. There's also some element of people taking more responsibility for their actions.
Yeah, what do you do with the patient, doctor? And I know you're a psychiatrist, but my husband does all the dialysis in Las Vegas. So we know that smoking, obesity, lack of exercise. So patients are on the machine for 3 hours. They get up, they light up a smoke, and they go grab McDonald's. Now, how responsible should that doctor be because the patient is being irresponsible?
Well, it's a heartbreaker. I mean, certainly in your husband's field of work, but so many of health costs are in some ways avoidable. Again, we have to be very clear. I mean, there are people who are genetically endowed to develop certain diseases. There are people who are just unlucky. On the other hand, smoking is 100% avoidable. We're seeing in America an obesity crisis, doubling of obesity rates over 25 years, and the best evidence seems to be it's just we're taking in too many calories. I think part of that is a government solution in terms of like school lunch programs, funding better school lunches. I think part of that comes from the corporate community. I'm excited with Safeway and what they've managed to do to better people's health. But part of it is also culturally, people have to take more responsibility. It shouldn't be societally acceptable to smoke. And yet, in a lot of ways, it still remains somewhat glamorous.
I'd like to compliment your summary. I'm in complete accord with the several points you made. But to make the point from our purpose being here, I think your goals will be much more readily achieved in a single-payer system with improved access. And for that reason, I commend you to consider that option.
Thank you.